It was just a week ago that I was here talking about how the things we're all feeling are normal: stress, anxiety, fear, grief, a little anger, some sadness. And this is science, just like public health strategies that Dr. Amy are talking about are science. Mental health care is health care. The brain is part of the body. The first thing I want you to know is that we want all Ohioans to know is that behavioral health care is open for business. It's part of the vital health care system. And so for those citizens who are already having mental health challenges and addiction issues, and you're part of the service system already, please stay in touch with your provider. Please keep your appointments. We want you to get the care that you need for those issues, and stay connected to your services and appointments. If you're not sure if you should go in for your appointment, please call your counselor, case manager, your provider, and see if you can get care through telehealth. That's available now through both phone and online through video conferencing as well. We want you to take your medications if you're prescribed medication, and to stay in touch with your prescriber and to get refills, and if you need any injections, to get those on schedule as needed. And if this is the first time you're experiencing any mental health concerns or problems with alcohol or drug use, we want you to reach out for help. Providers are still taking new patients, and we want you to reach out for help. The most important thing to know is that you are not alone. I know that we've been talking a lot about social distancing, and that really means physical distancing. There are new ways for all of us to figure out how to stay connected to care and to connected to each other socially, and we're all doing that, but you are not alone. During this crisis, we've compiled resources for all Ohioans to connect to make sure you're staying home, but still getting the support that you need. So go to coronavirus.ohio.gov and click the tab for Resources for Adults. It lists the contact information from our department, Mental Health and Addiction Services, and provides critical hotlines and resources that you would need to take care of you. And we'll continue to update this page with videos and tip sheets and trainings and other resources over the next several days, and make those available to everyone. If you're in crisis right now, please use the crisis text line, which is for HOPE, to 741-741. So text for HOPE to 741-741 if you need to talk to someone immediately. If you're thinking about hurting yourself, please call the Suicide Prevention Lifeline at 1-800-273-8255. Remember, this is temporary. You are resilient. Ohio's resilient. We have grit. Give your family a sense of hope. You've done hard things before. You can do them now. Name your challenges, set goals, and take actions to solve your problems. Some of us were already in a hard spot before this started, and so this may make it even more difficult for you right now. And we want to make sure that we're supporting you and your families. So ask for help when you need it. There's a lot of help out there. And now I just want to talk briefly about some tips for managing stress with kids and families. And these tips can be found online, and more tips as well. The first thing for all of us to remember is that kids take their cues from adults. And that's from newborns to teens. Young people feel the energy that grown-ups are putting off. And so here are some simple things we can do to help ourselves feel better and to help them feel in control as well. The first is talking with your kids about what's happening. Sometimes kids feel responsible for things that are completely out of their control, and it's important for us to talk to them and share information that's digestible for them as kids, not to talk to them as adults. It's also helpful for your family to have a plan of how you're doing your part to prevent the spread of coronavirus and to help take care of each other within the home, and for kids to have a role in that as well. So make sure you include them and encourage them to ask any questions they have and share their feelings and take those seriously. We should also all be monitoring and limiting our media exposure. There's a lot of unhelpful information out there, and we need to make sure that we're monitoring what our kids are watching, what they're hearing, and what they're reading as well. So remember, Media is there 24/7 for our convenience, but not for our consumption. And we need to step away and unplug. But when we do plug back in, use trusted resources and make sure that your kids are doing the same. Most of us are not used to being with members of our family and household 24 hours a day, 7 days a week. So this is hard, and it's not always pretty. Personal space and quiet time away is important for all of us. So we need to make sure we find a way to create that within our homes, both for our kids and for adults. It's also helpful for us to remember to use our manners to keep our cool. And so saying please and thank you makes it a little bit harder to snap at each other. I know it's harder for me to yell when I'm saying, please clean up this mess. Thank you. And if I'm acting stressed out, a tool that I always use to help me get back in gear is a little acronym, little word called HALT. So HALT. If I'm feeling hungry, angry, lonely, or tired, I need to take care of myself and then go back into action supporting other people. So that's HALT. Hungry, angry, lonely, or tired. And then finally, try to maintain a routine for your family. It's different than your normal schedule each day, but make sure that you're maintaining a routine. That's really important for young people, kids in our homes to feel secure. This is a time for us to slow down. We're not used to doing that. We can connect in new ways with our family inside and outside of our home and do those projects that we've been meaning to do, spend more time together, either in person or remotely. And remember, a smile and a kind word go a long way. So with that, I'll just say be well, stay well, physically and mentally. Thanks for the ability to be here today.